Ibrahim Rashad, I'll be the family nurse practitioner today conducting your head-to-toe physical exam. Can you go ahead and give me your name and date of birth?
My name is Hera Khan. My date of birth is January 1st, 1995.
Okay, do you know where you are right now?
Yes, the doctor's office.
Okay, do you know who the president is currently?
Yes, Donald Trump.
Okay, can you tell me more about your medical history, any current illnesses?
No medical history.
Are you on any medications?
No.
Okay. Are you any allergies to medications?
No allergies.
Are you up to date with your immunization?
Yes, I am.
You are, okay. Any drug use, smoking, or any drinking?
No alcohol, no drug use. No.
Okay. At this point, I've already collected the information regarding the patient overall appearance, which seems to be appropriate for their age and the situation. They're able to answer all questions without any delay. They're alert. The skin color seems to be matching their ethnicity. Speech is clear, as well as they are able to talk to me without having any drooping with a visual clear to the visual eye. And their overall behavior seems very calm, collected. Overall hygiene seems to be very appropriate, clean, and good hygiene. The overall posture at this point seems to be aligned. We will be collecting more data as the assessment goes on. Next, we'll go ahead and do your vital signs with the blood pressure monitor. We've checked your blood pressure, it's 120 over 70. Heart rate is 75. The respiration had been noted being 18. And your temperature was 97.9, which is normal. Any pain that you're experiencing right now?
No pain.
Okay. Is there any health concern that you would want to discuss?
No.
Okay. So we'll go ahead and continue on with your physical exam. If I may, able to just pinch the top of your hand here just to check the skin turgor. It returns immediately to base, which shows adequate hydration status. There's no signs of any cyanosis or any clubbing on your finger nails. Capillary refill is less than 3 seconds, which is adequate amount of oxygenation that is shown within your body, which is a normal finding. At this point, we'll go ahead and continue with your exam. We'll be next inspecting the head of the patient. The overall appearance of the face will also be assessed. Within the patient's head, we are looking to check for the size if it's appropriate matching the body. Within the head exam, we'll also conduct the 5th and 7th cranial nerve, 7th cranial nerve being the facial nerve, and the 5th cranial nerve being the trigeminal nerve. Okay? At this point, I don't see any twitching or any lesions that you usually find in autoimmune patients. So skin's very well formed, it's intact, there's no facial twitching, no drooping, and I can tell the pupils both are round and they are aligned. There's no sign of anisocoria, which one of the pupils or the eyes is uneven to the other contrary pupil. If I may, feel for your temporal artery bilaterally, it's +2. Any pain or tenderness?
No.
Okay. May I feel for your jugulo-digastric lymph node here? Okay. Along with the lymph nodes, we'll be conducting them throughout the exam. Okay. Your hair, there's no hair loss, there's no alopecia. If I may be able to feel your head. Head, cranium, there's no masses or any lesions. There's no patches, like we've mentioned. The patient is able to present with overall great hygiene in the head towards the head region as well as the scalp and the cranium. At this point, we've collected the information regarding her temporal artery as well. It's bounding, it's 2+, and there's no mass or any tenderness. We'll continue with the TMJ as well as the sinuses and the trigeminal and the facial nerve. Okay? Go ahead and smile for me, please. Frown, clench your teeth, puff your cheek. Cranial nerve number 7 is intact. Okay? If you can go ahead and open your mouth against resistance to my hand. Okay? Go ahead and move your head, open your mouth and move it side to side. Okay? cranial nerve number 5, which is important in mastication, trigeminal nerve is intact, and there is TMJ did not have any crepitus, nor any grinding. Okay. At this point, we'll go ahead and grab a cotton, and we'll probably do a light corneal light reflex as well. And upon here, I will be checking. I'll be lightly touching the eyebrow. The natural reflex of the eye would be to close the eyelid, which would be the corneal light reflex. At this point, we have collected the information regarding the cranial nerve number 7 as well as the cranial nerve number 5 being intact. Temporal artery does not have any masses found or any tenderness, and patient is able to open and close the mouth without any pain, and that gives us some great information. So what we can go ahead and do now is we'll go ahead and assess your eyes. The eyes, if I may be able to feel just a little bit here, pull this down a little bit. Conjunctiva is pink and moist, no signs of any jaundice, no redness, there's no signs of any hemorrhage, and the pupils bilaterally look equal. No signs of anisocoria, no signs of any strabismus as well. Anisocoria, which is just a unilateral pupil size, which shows signs of neurological damage or effects. We'll go ahead and do the 6 cardinal fields of gaze. If you can go ahead and follow my finger in 6 areas that I'll be moving this towards, okay? Okay, one last one. You can go ahead and follow my finger. Okay. Patient's cranial nerve number 3, 4, and 6, which is the oculomotor, trochlear, and abducens, are all intact. Patient's pupils are also able to accommodate. At this point, we will go ahead and check to see if your pupils are reactive to light. We'll dim the lights, and I'll grab a pen light, and I will come from this side. And the pupils should constrict and then return back to the original size. Usually the pupil size is 3 millimeters. It does constrict down to 1 millimeter and then returns back to 3 millimeters. I will do that to both sides. Okay? Both eyes bilaterally. And so at this point, your pupils are equal, round, reactive to light and accommodation. The second test I will go ahead and conduct now is the peripheral vision, which is the optic nerve, cranial nerve number 2. And ask you to look straight ahead and let me know when you do see my hand wiggling on the side, okay? You can go ahead and state okay when you do see it, okay? Here we go. Ready, set, go.
Okay. 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 Okay.
Okay? So at this point, the patient is able to have good peripheral vision, which your eyes have cranial nerve number 2 when it does depict the functions of the cranial nerve number 2. Okay? And what we can go ahead and continue with now is stating that recapping your eye assessment as well as the head. The patient's extraocular muscles were intact. Patient's pupil are equal, round, reactive to light and accommodation. The peripheral vision was also intact. The view of the remainder portion of the assessment here for your eye will be the Snellen chart, which is checks for visual acuity. Here we'll go ahead and have you stand 20 feet away from the chart, and we've conducted that test, and your visual acuity is 20/20. The visual acuity Snellen chart, which is popularly known, is where the provider will have to have the patient stand 20 feet away from the considered readable line in order for the patient to correctly identify the characters provided within the test. if the patient is unable to have less, if the patient is not able to have 7 characters correct within the 10 character line, that line is marked incorrect, and therefore you would have to have the patient read the line below. So the visual field of this patient was also intact, and the corneal light reflex was also intact. Facial nerve number 7 and 5 intact. Conjunctiva was seen to be pink and moist, no swelling, no tenderness, nor any pain upon palpation of the eyelid. We'll go ahead and check for your sinuses now. The frontal and maxillary. Maxillary will be here. I'll press gently down. Tell me if you feel any pain.
No.
Frontal?
No.
Any pain? Okay. Thank you for that. We'll go ahead and next move on to the ear examination. Okay? Here, what I'm looking for first is to see if there's any drainage. Excess drainage is not noted. Here next, I will also check the other ear. Okay? No drainage. Next, I'll go ahead and feel bilaterally for any pain. Do you have any tenderness?
No.
Usually we find tophi, which is accumulation of pretty much uric acid. It's an abnormal finding, which we don't find here. Next, I will go ahead and check cranial nerve, assess cranial nerve number 8, vestibulocochlear. And here, what I'm going to have you do is I will have you cover your right ear, and I'll whisper 2 words. You can go ahead and tell me what those 2 words are, okay?
Apple, banana.
Okay, thank you. Same thing with the other ear.
1, 2.
Thank you. At this point, cranial nerve number 8 is also intact. We'll move on to the fundoscopic examination. With the fundoscopic examination, with the main purpose of that exam is to check the back of the eye of the patient for any abnormal findings such as vessels detached. We're at this point looking for the red reflex, we're looking for the fundus, macula, as well as the retina. Here, we'll go ahead and make the room dark, as well as have the patient move the eye around, which is part of the assessment. Okay. Here, the findings, the normal findings that we'll be seeing is if the macula is present, if the optic disc is right around 0.3 millimeters, whether if the cornea is clear with no lesions, and the iris is expected to be reactive to light and round. The retina should be sharp with a sharp margin towards the disc. Here, the patient did have all those expected normal findings. We were able to visualize the fundus within the fundoscope. Okay. Most importantly, we did dim the lights. Okay. We'll go ahead and turn the light back on, and we'll go ahead next and assess your nose. May I go ahead and feel for your palpate your nose? Any pain or any tenderness?
No.
Okay. Thank you. And if you can go ahead and tilt your head higher a little bit, thank you. The septum is not deviated. If you can go ahead and close each nostril and blow in and out. And then the other one. Okay. Patent nostrils. And I will go ahead and take a pen light and assess. Turbinates are fine. They're expected finding. There's no discharge. And the hair follicles were fine in texture. At this point, we'll go ahead and check your cranial nerve number 1, the olfactory. Here, I'll go ahead and give you something to smell, and you can go ahead and tell me if you're able to smell this or not, okay? Okay. Okay, first you're going to have to close your eyes. Thank you. What would that be?
Mint.
Mint. Perfect. Cranial nerve number 1, olfactory, is intact. Okay. And we'll go ahead and, so we've done your eye assessment. We've done your ears. Okay. Actually, one thing we're going to go ahead and continue with your ear exam is by looking straight in your ear. For an adult patient, we're going to go ahead and pull up and back. For a pediatric, we will go ahead and do it down and back to straighten out the ear canal. Here, I'm looking at the tympanic membrane. Here, your tympanic membrane, I'm looking here, it is purely gray, shiny, and I do see the cone of light on your left ear. The cone of light is at 7 o'clock. On your right ear, the cone of light is at 5 o'clock. There's no excess drainage or any excess wax buildup, which is a normal finding. Next, we'll move on to your mouth. We do see lips are pink and moist. Well-hydrated patients have that texture. What I'll go ahead and do is, if I may, I'll go ahead and put some gloves on, and then I'll go ahead and assess the inside of your mouth, okay? All right. If you can go ahead and open your mouth. Here, I'm looking for each teeth. There's no cavities, no missing teeth, no loose teeth, and I'm looking at the mucous membranes as well as the tongue. Tongue and the mucous membranes are both pink, shiny, moist, and there's no lesions, there's no bleeding, gums. The tongue is not what you find in pernicious anemia, which is beefy red. The tonsils do not have any exudate. The uvula is midline. Thank you for that. If you can go ahead and lift your tongue up so I can see underneath, okay? No lesions underneath the tongue as well. Here is where we usually find sores and other kind of cancers that kind of like to hide around in there. Overall, the hygiene of the mouth is it's adequate. It's normal finding, and teeth were all intact. There's no foul odor coming from there. Here, the important cranial nerves that we find are two. There is 12, actually 3, 12, 9, and 10. The 9th is glossopharyngeal, and the 10th being vagus. Those two work hand in hand. If you can go ahead and say uvula retracted back. Can you go ahead and swallow for me? Thank you. Cranial nerve number 9 and 10, both intact. At this point, I assess patient's trachea, which is midline, does not shift to either side. Cranial nerve number 2 is hypoglossal, and that's when you are able to move your tongue left and right. Here, I'll go ahead and grab here, you can actually go ahead and open your mouth, move your tongue right and left, laterally, perfect, maybe up and down as well, okay. Cranial nerve number 12 is intact. You're doing great, thank you. Any questions so far that you meant? How's your health and overall activity level outside?
It's moderate. It's good.
Moderate?
Yeah.
Okay. How often are you going to the gym or exercising?
At least 3 times a week.
Okay. So, 3 times a week, that's actually pretty good. The American Heart Association definitely encourages people to exercise a minimal 3 to 4 days, at least 30 minutes a day, which helps support the improvement of cardiovascular health. Okay. How's your school? Any stress that you're concerned about?
No.
Here at this point, we're also assessing the patient's psychological history. Mental health is also another big component at a young adult's life, whether if it's male or female. Important factors to be collected from the ear and mouth exam is that within the ear, we found cranial nerve number 8, which is vestibulocochlear. And here, we occluded one ear, and we did the whisper test with 2 words. Patient was able to recognize those. Here, we also found the tympanic membrane, which was intact. The tympanic membrane was pearly gray, shiny, and we also found the malleus, the trabeus, and the incus. Okay. The most important portion is that the cone of light was also visualized, the left being at 7 o'clock, the right being at 5 o'clock. There was no pain upon palpation of the tragus and the tragus as well as the pinna, and there's no tophi that's felt or seen visualized by the clinician. Now we'll conduct the Weber and Rhine test. With the Weber test, we find that It tells us whether if there's any issues with the conduction hearing loss. If you have any issues with hearing, okay? With the tuning fork, I will go ahead and tap it, and I'll place it in the center of your head. Tell me where you hear the sound more or less on each of the ear. Or if it's normal, we'll go ahead and hear it equal on both sides.
It's equal.
It's equal? Okay. Now we'll go ahead and conduct the Rhine test. Here in the Rhine test, we're checking for air to bone to air conduction. In a normal finding, we'll find that the air conduction is greater than the bone. Okay? I'm going to grab a tuning fork, tap it. Here, laterally I'll apply it to both ears. Each side will conduct it the same way. Tuning fork tapped, and what I'm going to do, place it laterally. When you can no longer hear it, let me know, and I'll place it I'll place it on the master process. Okay? Tap.
No longer there. Okay.
Thank you. Same way on the side. Okay? For this patient, the air conduction was greater, which is a normal finding. Within the examination, we find that your cranial nerve number 8, which is vestibulocochlear, is intact. Thank you for that. Now we'll go ahead and move on to the lymph nodes. We'll go ahead and start off with, here, I'll be feeling for your lymph nodes. Within the lymph nodes, we are looking for they're actually termed, there are quite a few. You might be a little overwhelmed, but rest assured, it won't be long, okay? Thank you. Palpation is one of the portions of it. We'll go ahead and do the cervical lymph nodes, okay? Pre, post cervical, occipital, right above the base of the skull, or at the skull, base of the skull. Okay? Parotid, right next to the tragus. Jugular-digastric, we're palpating, we're just feeling for any masses, tenderness. Submandibular, any pain, ma'am? Submental, okay? Mm-hmm. Now we're going to go ahead and move on to the superficial cervical. Deep cervical chain. And posterior cervical. And then supraclavicular. Any pain there?
No.
Okay, lymph nodes were palpated. There was no abnormal finding in terms of masses or any tenderness that the patient had voiced. Okay, the trachea was previously already palpated and assessed in terms of the alignment. It was midlined, and there was no shifting of the trachea to either side when the patient did swallow. The lymph nodes were not enlarged, so that's good. Usually the lymph nodes, they drain the lymph fluid. It helps the circulatory system perfuse well and supply adequate amount of oxygenation to the important vital organs in your body. Any questions so far?
No.
Okay, so at this point we've assessed your eyes, we've assessed your nose, we've assessed your mouth, ears, hair, temporal mandibular joint, which was negative, there was no crepitus, temporal artery. Now we're going to move on to the jugular vein, the carotid artery, and assess your neck region, okay? We'll go ahead and do your thyroid test first. I'll come right behind you and palpate your thyroid. I will ask you to turn your head to both sides and assess for any enlargement, okay? It might seem as if I have both arms wrapped around you, but I do apologize for that specific position, okay? If I may, I'll be palpating here. Go ahead and move your head to the left. Swallow. Right. Swallow, okay? Lymph nodes as well as the thyroid test was negative. There's no enlarged thyroid gland. And within the test, there was no abnormal finding. After the thyroid test, we'll go ahead and conduct your carotid artery. We'll be conducting the patient's carotid artery. Here, we're checking one side at a time, unlike other pulses, or we are usually doing bilaterally. Carotid, you cannot and must not do bilaterally. Okay? Here, we're grading from 0 to 4. Okay? We'll also auscultate your carotid artery for any bruits. Usually, we hear swishing, and there, I'll go ahead and ask you to go ahead and take a deep breath, and then just hold it, okay? Here, we'll have the patient lie semi-fowlers. And we're looking for the jugular vein. Well, I'll ask you to turn your head to your left side. And we're looking for jugular vein distension, which the patient does not have. Carotid artery, we'll go ahead and palpate and feel for any masses or any lesions. For any masses. Bilaterally, we're not going to do. So just one at a time. Jugular vein distension. Can you go ahead and turn? Okay. No jugular vein distension there. And both sides, the carotid artery was +2. With the bell of my stethoscope, I will be asking you to take a deep breath and then hold it, and then I'll listen to any swishing sound which indicates bruise. We'll go ahead and take a deep breath and blow out and then hold. Okay? I think it might help placing the thing. Thank you. Hold. Thank you. Negative test. Next, we will go ahead and move on to the assessment of the chest here. Here we'll be inspecting the chest for any barrel chest that we find in COPD patients. We're looking overall the respiratory effect. In this patient, there was no labored breathing. There's no signs of any tachypnea. The patient does not obviously have a barrel chest. And we're going to go ahead and also assess the skin. Here, the skin's intact. The color matches the ethnicity. There's no open wounds or any lesions. And we're going to go ahead and auscultate the patient's heart sounds. We're going to start off by hearing the aortic, pulmonic, both in the second intercostal space, aortic being in the right, the pulmonic being on the left, okay? The Erb's point is then found on the third intercostal space to the left. The tricuspid is found in the fourth, and then the mitral, which is the PMI, point of maximum impulse, is found on the fifth, okay? Intercostal space on the left lateral side, okay? If I may just listen to your heart sounds. On the mitral, when I get to the mitral heart sound, I'll go ahead and listen to 1 full minute for the pulse. We're trying to hear the heart sounds rate as well as the rhythm, okay? Second intercostal space, I'm going to put the diaphragm. Mitral, I heard for 1 minute, the rate was 65, and the rhythm was regular. There was no other sounds, abnormal sounds. So here we did hear the S1 and an S2, which we're looking for, hearing for, and your heart sounds were normal. Okay. You did mention there's no heart history in the family. Any concerns you might have with your heart? Okay. Next, we'll go ahead, like we mentioned. Continuous education is to be provided about the heart and the cardiovascular health for any patient we do see. The mitral valve, which was the point of maximum impulse, is a very important portion of for a clinician and a head-to-toe assessment only because we can provide valuable information. Here in the since we're here towards the chest region, we can go ahead and check the pericardium. I'll go ahead and place my palm of my hand towards your apical region. We're looking for pulsation, excess pulsation, any thrills that we're finding, and it's negative, where we were not able to feel for any extra pulsation or any thrills in the pericardium. Okay. The upper extremity pulses, as well as the epitrochlear nodes, and the range of motion, muscle strength, are all assessments that we can actually conduct right now. Okay, if I may, feel bilaterally your radial pulse. 2+ brachial. 2+ epitrochlear nodes will be right slightly inside next to your brachial pulse. Feeling for any masses, any lesions, negative. Thank you for that. And range of motion. May I feel, actually, yeah. Go ahead and push my hand. Okay. Pulled my hand. Okay. Strong. Okay. And we'll go ahead and, let's see, here. Let me go ahead and squeeze my hand. Neurological. Yeah, so usually a patient with stroke, they're not able to squeeze, have the same strength in both hands. Range of motion for the patient was intact. Patient was able to abduct as well as adduct with the joints not being any pain or any tenderness for the patient. So therefore the joints were also assessed. Pulses were strong and regular pulse in terms of their rhythm, which is a normal finding. Next, we'll move on to the lungs. Here we'll be auscultating both anterior and posterior, looking for the skin color as well. While we're in the posterior region, we can go ahead and assess the spinous process. Here we'll also conduct the costovertebral tenderness test and check for breathing symmetry. Okay. If I may, I'll start off by listening to the lungs anteriorly. I'll start off in the apex, which is right above here, okay? It's important that I also listen to the lower lobes. Go ahead and take a deep breath in and out. Thank you. Thank you very much. Now, lung signs were clear, non-labored breathing. The skin we've assessed also. It's there's no discoloration, and we'll go ahead and listen posteriorly as well. If I may ask you to, perfect, thank you. Here we're listening to the lungs. Slightly a little bit more, thank you. Okay. Here we're listening posteriorly, starting from the apex. It's important to get the lower lobes as well, the right lower lobe, thank you. Here we can also, you can stay in that position, thank you. Here I'm also checking for the CVA, costovertebral tenderness. You'll find that in the right below the 12th rib, left side. I'll be placing the palm of my hand, tapping gently at the patient if they feel any pain or tenderness. Do you feel anything? No. Okay. Here, check for symmetry of the breathing. Go ahead and breathe in, breathe out. Okay. Equally, the breathing was symmetrical, and I'll do the same in the front. Next, since we're back here, we'll go ahead and conduct the tactile phrenitis. I'll go ahead and ask you to say 99. We're here, we're looking for the vibration. It should be good vibration in all sides. Go ahead.
99, 99, 99, 99, 99.
Same in the front. Thank you.
99, 99, 99, 99.
Yeah. So towards the that's okay. Towards the lower region, when you do get to the lower lobes, it's very important. You have the patient to raise their hands up to get a good sense of vibration and sound. Therefore, you can collect some accurate data. Next, I'll go ahead and percuss. And here we'll also look for any bell sounds. Same thing in the front. Good vibration. Okay. Tactile fremitis completed, and what we can go ahead and do now is we're also looking for the we've already done the skin assessment, so you can go ahead and move back to the original position. Thank you. Lung sounds we heard, chest, heart sound we also heard. We did a jugular vein distension. We made sure we looked at that. Carotid artery was bounding. There was no bruise heard. Precordium was assessed. What else? Now we can go ahead and move on to the abdomen. Abdomen assessment is slightly different as we're initially doing the auscultation. I'm sorry, inspection, auscultation, percussion, palpation. Here we'll also assess the patient's bowel movements and urine output if there's any difficulty urinating. Within the abdominal assessment, we're checking for the stomach's contour, whether you in this patient, we'll have them lie down, and upon having them lie down, we find the patient stomach is flat, it's not rounded, there's no signs of any distension, and at this point, we'll also go ahead and, after just looking, we'll go ahead and listen, okay? Here, I'm listening to bowel sounds, and at this point, the patient is lying down, okay? I'm listening from the right lower quadrant, moving clockwise. I'm listening for bowel sounds. They should be 5 to 30 sounds. If I'm not able to hear the bowel sound, I'm listening to each quadrant for 5 minutes. Your bowel sounds, as I heard, right lower quadrant, clockwise, normal active, okay? And here the patient, after auscultating the bowel sounds with the diaphragm, they were found to be normal active. The patient's stomach was the patient's contour was flat, which is a normal finding, and the right upper side is where we find the liver. Here you'll find the right liver, spleen, and kidneys are all assessed in this region, which we'll do towards the end of the abdominal assessment. Since we're listening to the abdominal sounds, we'll also listen with the bell for the bruise heard in the aortic artery, the renal artery, the iliac artery, as well as the femoral artery. Okay, femoral artery, which is found in the right and left groin, the iliac artery, which is right a few inches below the belly button at the right and left side. The renal artery you'll find in the left and right aortic side. Okay, and the aorta, which is right below the xiphoid process. Here the patient is lying down. We've placed the shirt up, and with the bell, I listened for bruise in each of those regions: the aorta, the renal artery, the iliac artery, and the femoral artery. Here, since the patient is lying down, we'll also assess for hernia. How can we assess the hernia? You might be wondering. Is we're going to slightly have you raise yourself up slightly. At this point, we'll also have you lift your leg. That way we see any protrusion, which is an indication of a hernia, which we can go ahead and further assess, okay? In the abdominal assessment, I'll also be percussing the abdomen. Okay? Thank you very much. Now, I would be doing light palpation and then deep palpation. Light, deep. Any pain or any tenderness, okay? Now, what we can also do is, let me ask you, have you had any problems with your bowel movements or any urine output, burning sensation, recent UTIs?
No.
Okay. So we're going to go ahead and, if I may, be able to palpate anteriorly and posteriorly. It will give me some more information to add towards my chest and lung assessment, okay? Thank you. Posteriorly, I'm also palpating. Here I'm looking for any masses or any lesions. Well, I'm looking for any lesions, but I'm feeling for any masses that there might be. And there are none. So we've done the light and deep palpation there. What we'll go ahead and conduct now, next is the spleen, liver, and kidney. We're going to check for the liver span, and I'll be doing that by starting from the top here and percussing until I will be going down until I hear a dull sound. I will mark that, and before we go ahead and do that, we'll go ahead and ask you to take a deep breath and hold it in, and go ahead. And I would go ahead and mark that. You could blow out. Thank you. You could breathe normally, and take a deep breath and hold it in again. Thank you. And I would also mark that. It should be between 4 to 12 centimeters. Now, do you mind if I go ahead and percuss your lungs posteriorly again? Here, what I'm doing differently is asking you to breathe in and hold it in. Okay? Okay, breathe normally. Thank you. We'll go ahead and continue. Thank you for that assessment. We'll go ahead and continue palpating. This also will include the light and deep pressure, okay, when I feel for your kidneys. And here, when the patient is lying supine, we are reaching right below the right lower side, or right mid portion, and lifting slightly while palpating the top portion and feeling for any mass or any hard feeling, and we'll do it both sides. And that would be for the kidneys. The liver border, which is in the right upper section of the abdomen, is what we also found to be normal after light and deep palpation. In patients with cirrhosis is where you find a lot of pain there, along with abdominal distension. Okay, but yours was normal. We'll move on to the lower extremities. Once again, patient is lying supine. Here we're checking for the color of the legs to the toes, normal hair growth. Usually with people with PVD, peripheral vascular disease, they have hair loss. Okay, we'll check the temperature by the dorsal portion of our hand. It should be warm. Okay. In both sides, equal amount of temperature. There's no swelling noted. There's no redness. capillary refill of the toes, which you can go ahead and by doing the blanch test. Okay, and capillary refill was less than 3 seconds, which is good for fusion. And here we'll go ahead and also check the assessment of the toes, nails, the overall hygiene. There's no fungal infection that's usually noted in the toenails. Overall great hygiene. There's no foul odor, and the patient's overall skin has good texture as well as turgor. We also continue doing the turgor with the pinch, superficial region, and it did return immediately to the base. Now we're also going to go ahead and assess the joints. And how do we do that is by, I'm going to go ahead and ask you to, I'll be lifting your leg slightly, and I'll bend this slightly to the chest. Any pain? No. Okay, and I'll do it to both sides. Any pain? Okay, since I'm here, I'll go ahead and also check for the pulses. Here you'll find the dorsalis pedis, which is on top of the foot, the posterior tibial, which is right in the ankle side of both feet. Pulse is 2+ on each side. We can here check also for an edema by checking the tibial region, by pressing the tibial region. We don't see any induration, both sides. There's no calf warmth, excess calf warmth for any DVT signs that usually are found here as well. Any pain in your foot? No. The soles of the feet, especially in diabetic patients, is where we find circulatory issues, any infections, and this is where is a good area where I can go ahead and educate regarding diabetic foot care. There's no hair loss in the legs as well, so good circulation. Here, I'll also check the popliteal pulses bilaterally, +2. Once again, dorsalis pedis, posterior tib, which is an inner area here. Thank you. And the femoral pulse, and then the inguinal nodes, which we'll go ahead and surpass for the test. Overall, there's no swelling and edema noted like we usually find in CHF. Any difficulty breathing that you're feeling okay? Usually CHF is accompanied by shortness of breath. Okay. What we'll go ahead and do also now is check your reflexes. There is few brachioradialis right in between the radial and the brachial. The brachial is right in the inner portion. And here I'll be using the hammer. I'll go ahead and test your brachial first, if I may. Tap. Thank you. Other. Tap. Thank you. Radial. Thank you. You see minimal twitching, which is a normal finding and an expected finding. For the tricep reflex, we're going ahead and ask the patient to lift the arm. Thank you. You can lift it slightly right there. Thank you. And I'll tap it just above there. Twitch. Thank you. Normal finding. We'll do the same thing to this region here. Tap. Thank you. The Achilles tendon reflex, it's right behind the foot. Okay, here we'll find, I can just tap that and it'll elicit the reflex both sides. Thank you. Brachioradialis, I'll go ahead and, if I may. Oh, sorry. Tap, tap, reflex elicited and both sides. Thank you. Here, we'll go ahead and we are near concluding the physical exam. And we'll just recap and make sure that we've assessed all aspects, okay? Lower extremity, we also felt with the dorsal portion of the hand, temperature was okay. Tibial, the region did not show any edema. Peripheral pulses were bounding to plus or great. Reflexes were all intact. Range of motion intact. Inguinal nodes felt, no masses or any abnormal hard masses. Upper extremity pulses were all +2. They were strong. Upper range of motion was intact. It was strong as well, and the patient was able to overall help with the assessment by great motor function. The head assessment showed no abnormal findings such as any hair loss. Cranium was intact, and hair is great texture. There's no patches. The mouth, clean hygiene, tooth not missing, no cavities, no exudate on the tonsils. Soft and hard palate were also assessed. There was no abnormal findings there. Tongue was very moist, pink, mucous membranes, pink, moist, very good finding. No excess salivation. There's no what usually we find is a beefy red tongue, which is, like we mentioned, in pernicious anemia, which you don't have. Well, uvula, your cranial nerve number 9, 10 were intact. Your cranial nerve number 12 was intact. You were able to swallow. Now, cranial nerve number 11. Go ahead and shrug your shoulders against resistance. Thank you. Cranial nerve number 11 intact. Your cranial nerve number 1, olfactory was intact. Optic was also intact, which is number 2. 3, 4, 6 were oculomotor, trochlear, and abducens intact. Trigeminal 5, facial 7, both also grossly intact. 8 was your olfactory. 8 was the vestibulocochlear, the hearing, with the Ryan and Weber test showed that it was intact. 9 and 10, your glossopharyngeal and the vagus were intact. Accessory 11 intact, and 12 the hypoglossal was also intact. And lymph nodes we palpated, no masses, no pain, no tenderness. Ear assessed visually, we found with the otoscope, the ear canal, we didn't find any abnormal finding, no excess drainage, no wax, excess wax buildup. Tympanic membrane was pearly gray, and it was shiny. Cone of light, the cone of light was seen. Eye exam showed no vessel damage. The fundus was visualized. The retina, there was no lesions. Your optic disc was seen, and chest assessment was done. Your heart sounds were listened to. There's no bruise heard in the point of maximum impulse. No precordium was clear. We were not able to find any excess pulsation that we usually find. Negative JVD, like we've also mentioned. Carotid artery was not hard. No bruise heard there. No pain or any tenderness. Unlabored breathing. Symmetry was equal of the breathing that we found via assessment. Tactile firmitis done in terms of via lungs. We found heard good vibration sounds. Palpated anterior and posteriorly, no pain or any masses that we felt today. And abdomen heard normal active bowel sounds. Light deep palpation completed. Okay. Spleen, liver, as well as your kidneys palpated, felt no pain that you mentioned. We've calculated and measured the liver span, and we've discussed your diet, exercise, slightly cardiovascular health. We heard the vascular sounds, the aorta, renal, iliac, renal, and then the femoral. No bruise heard. And you had normal active bowel sounds. We heard about 5 in each quadrant a minute. peripheral pulses were bounding to a plus. No edema. Capillary reflow was negative. It was negative less than 3 seconds. And overall, you had a good, normal physical exam. Do you have any questions?
No, I do not.
Thank you for participating in the test.